Let's see here. Okay. So I am calling this regular meeting of the Boulder County Board of Health to order at 5:31 p.m. on Monday, January 11th, 2021. All board members who are present, please announce yourselves. I will go first. Craig Thomas, Board of Health President.
This is Jorge de Santiago, Vice President.
Morgan McMillan, Board Member.
Brooke Harrison, Board Member.
Okay. And Landy can introduce herself when she gets on. And then Jeff, I don't know, would you like to take the introduction of staff?
Yep. We have Marielle Barron on the phone with us today. We have Chris Campbell on the phone with us today, Sheila Davis, Tammy Golden, Indira Gujral, Bill Hayes, Kate Haywood, who's with the County Attorney's Office, Kelly Hinch, Joe Malinowski, Rita Mangan, Lexi Nolan, Jana Peterson, with who's the administrative manager for the county, is on the phone with us. Trina Ruland, also from the County Attorney's Office. Mark Rusin from the Commissioner's Office. Susie Strife from Oscar. And we have Chris Urbina as well, who's our Chief Medical Officer. That looks like that's all the staff that we have on the phone. If I've missed anybody, please go ahead and jump in. All right, floor is yours.
Okay, thank you. Okay, so we do have a quorum present, and this regular meeting of the Boulder County Board of Health has been called to order at the discretion of Boulder County Public Health Executive Director Jeff Zayak. Notice of this meeting was posted on the Board of Health's website as required by law and included the teleconference phone number and conference ID so members of the public could participate. Due to the current COVID-19 pandemic and the need for social distancing in compliance with the current public health order, this meeting is being held telephonically as authorized by the Boulder County Board of Health bylaws. Okay, now to the agenda. We have any public comments that are related to unscheduled agenda items. Okay, I'm not hearing any public comments. So item 2 is the approval of the December 14th, 2020 regular meeting minutes.
This is Morgan. I move to approve the minutes from the December meeting.
Okay, I second.
We have a motion and a second. All in favor? Aye.
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 Okay. Item 3, approval of transition of Boulder County Public Health positions to the Boulder County Policy Team and Office of Sustainability, Climate Action, and Resilience, or OSCAR.
Greg, I'll take just a second to sort of put some background on this and make sure you all know that I support the transition. So both of our folks in these positions, Colin Tome and Cindy Copeland, have been working really closely with Oscar and the Commissioner's Office for the last several years. And a lot of the work that we're doing under sustainability and under our air quality work has involved, as you all know, testimony at the Air Quality Control Commission, work that requires us to coordinate at a statewide level with the more people that we can get, the stronger we are, especially as it relates to a lot of these big policy issues. And our staff have done amazing and incredible work over this time. As you know, they've built coalitions, they've supported advancement of policies, not just among public health directors and county commissioners, but other stakeholders as well. And it's made a huge difference in helping us advance some of the work that we're doing at a statewide level. The thing that we've seen happening more and more is that there's been more and more significant work, and it's taken more and more of a policy approach using our county commissioners as a sounding board and as an advocacy group, as well as approaching our public health directors across the state to really advance some of these policies. And we see that this work with the formation of the Oscar office has the ability to further advance this work because it becomes a closer connection to our county commissioners and to our other offices across Boulder County in general. So we are proposing today that you consider and support the integration of both Colin's position and Cindy's position under Oscar. And we believe it will end ultimately in a stronger relationship with our county and a better link to policy and advocacy. In addition, Joe is going to walk through some of the benefits of that, but one of the benefits that we know will help support our staff as well is they've been working at this extremely high level of complex policy for quite some time. And this will allow them to advance as well as compensate them for the kind of work that they've been doing for some time. So we believe that there's multiple reasons to support this. And we're looking forward to continued work with Mark and with Susie as we move into the future. And with that, I'll stop and I'll turn it over to Joe, and he can talk about some of the things that we've been thinking about internally. As you know, climate and sustainability is a strategic priority for us, so we'll talk about that in addition to the benefits that we see here. And Joe, I'll turn it over to you.
Good evening, Board. Joe Malinowski, Environmental Health Division Manager. Thanks, Jeff, for teeing that up. I think my perspective is I don't necessarily want to lose any environmental health staff, but I think this is one of the times that it just makes a lot of sense to transition these staff to the county level. The upside is the work they're doing will definitely continue, and I'll talk about some benefits of that. And also the proposal is to include another FTE for public health to continue our work toward climate change, our priorities in public health. So again, while I hate to really lose staff, especially staff that work such an exceptional level as Cindy and Colin have, if you think about it, Greg knows this, we've come a long way in policy. When Pam was doing this work almost by herself, I felt like years ago, and then she was able to bring Cindy on board and Colin and start to work with the county policy group, and then Oscar and the commissioners, and then under the leadership of Bill Hayes, continue with Cindy and Colin. They really have, working with those coalitions and our county partners, just really have been able to advance legislation and policy to just create a whole new framework for us to work within to advance air quality and climate change policy in the future. And I think by moving them into the county, it just creates a lot of efficiencies. The reality is they're already working with those folks at the county level, especially Mark Resin's policy team and then the Oscar team on sustainability. They have direct access to our elected officials, not just our county commissioners, but Mark Resin and his team have developed long-standing relationships with our legislative, our elected officials, and they have those established relationships. And I can just see, although we have them as well, just by joining the group, it'll definitely enhance that. We work a lot with our county attorneys, and they're really integrated with Oscar and our oil and gas and policy work at the county level already. So we'll just enhance that as well. And then it will, because they do collaborate quite a bit, there's multiple meetings they have to go to. And the thought is, if they're actually on the same team, perhaps there'll be some less meetings, but still allow them to work together more efficiently to advance policy. Just that work we've been doing with the Air Quality Control Commission and the CC4CA and those organizations like CCAT and those county coalitions will just be enhanced by having both Colin and Cindy both working with them and the county to again, just really try to better support the work we're doing and just set it up, that structure, to be more effective in the future. Bill Hayes, the coordinator for the program, is also here to answer any questions. Susie Strife, who leads the Oscar program, and I believe Mark Resin for the policy group is also here if you have questions, but we'd happy to answer any questions you may have. But thank you.
Thanks, Joe. So does any air work stay with public health, or, get the policy piece has been a huge lift. I know there's other smaller pieces. So curious about that.
I think part of it will be, once Colin makes that transition and we get the new position in place, I think it'll be good for us to get together to really define what that work is going to be. I definitely see us still being the data gatherers, the stuff we're doing out at the lake. I see that definitely continuing. Bill, do you have more that you'd like to add?
Yeah, thanks, Joe. So Greg, you asked what would be staying in air quality. Did you mean what climate work in air quality or air quality overall?
I think air quality overall, Bill.
Yeah, so we still have a lot of work in air quality aside from our climate work. We maintain 2 monitoring stations for the state that do PM10s. We have our air monitor out at the Boulder Reservoir that does VOCs. That will continue to stay in public health. We have Rory Elmore, who is our oil and gas inspector. And now that we have, the county has passed Article 12, we've already started contacting oil and gas operators to get her out in the field with the IR camera to inspect our oil and gas facilities in Boulder County. And then we have our radon program that is currently funded through the CCPD. That funding does run out this coming June, and we are trying to identify funding to keep that program going. Through the CCPD, we were doing outreach statewide. And so it's not just Boulder County work. This was essentially radon outreach work for the entire state. So all of that work remains. And with this transition, Boulder County will maintain 1 FTE of funding for climate work. So it's not that Boulder County Public Health won't be doing any climate work. It's just the work that Cindy and Colin do for us, as Joe identified, we think will be more impactful with them and Oscar and the commissioner's policy team respectively. Next month's meeting, I think we're going to have on the agenda to ask the board to approve climate change as a strategic priority for Boulder County Public Health. That was on the agenda for last February, but with COVID, that got pushed aside. But we've been operating for the last year as if Boulder County Public Health has climate change as a strategic priority. We formed a climate action team. We have representation from all of the programs within public health on that team to help them identify how climate change is going to impact their services and how they can help their clients navigate those impacts. Susie and Mark and Lexi and I and Colin have all already talked about how to strengthen our collaboration and communication between public health and Oscar. And so if the board approves this decision, immediately we will get on the next step of formalizing that plan for how we're going to work together and coordinate. In the past, there's been a little bit of duplication as we weren't communicating well. And so we're really going to fortify that communication. And Colin and I have worked together very closely for the last 12 years. So I have complete confidence that she and I will continue to communicate and really form that bridge between our departments.
Okay, sounds good. Lexi, did you have your hand up or did you take it down?
I did, Greg, but Bill and Joe did a great job explaining, and I don't have anything to add.
Okay. All right, Morgan, see you have your hand up?
Yeah, thanks. I guess this is just a note to say, because I know that we had approved, and I couldn't remember when, but it sounds like it was just before COVID really hit locally, the addition of climate change to the strategic focus of public health. And so it would be great as this transition happens. I know that we have really packed meetings right now, but it would be great to kind of hear how this is all going to shake out between the commissioner's office and public health, what that program and focus division is going to be, and then also how climate change, really is going to be beefed up, I guess, as a strategic priority within public health. So maybe we can just put that on an agenda for an upcoming meeting. I know I would like to learn more about how that is going to shake out. Thank you.
Okay.
Morgan, I would agree with that. And that was our plan for the February meeting. We'll be coming to you not only to adopt that priority for public health, for climate change, but also be letting you know some of the longer term planning working with the county. So we'll definitely provide that update as well, and probably have some asks, some resources too. So stay tuned.
Great. Thanks, Joe.
And Bill, I know I haven't seen you in a while, but man, you're rocking that beard, dude.
Well, I don't know if it's a point of pride or whether I look like the next Unabomber, but you know, when we closed down the public health offices, some of us said no shaving till we're back in the office, and I think I'm the only one holding that up. So this is for all of public health.
Good job. All right. Any other questions? And so I guess my last question is the policy work for air. I mean, because I know that air and climate, a lot of times you get the co-benefits. And so will Cindy and Colin still be doing like the work before the Air Quality Control Commission?
Yes, absolutely.
Okay. Good to know.
Hey, Greg, I just want to see if it's okay if we allow Mark or Susie, if they have any comments as well, to jump in here and just add any comments that they might want to make. Don't know if they do or not, but I want to make sure since they're here, they have that opportunity.
Thank you, Jeff. Greetings, everyone. This is Susie Strife. I really, truly want to just echo everything that's been said. You did it so well, Joe, Bill, and Jeff, and it would be an honor to work with Colin. We've worked with her for 12 years already, collaborating, and I think, as Bill and Joe articulated, it would be a great enhancement, providing her sort of the step that she would need to be in the spotlight for the work that she's doing, especially on policy and climate change and air quality and health. We're going to keep all the good stuff that she's doing and just try to enhance and support her even more. So thanks for the opportunity to be here.
You're welcome. Man in the Gold Dome, Mark Rosen.
Thank you, Greg, and also big thanks to Jeff and Joe and Bill for the presentation. And just to underline what others have said, I just see this transition as being able to enrich the work that's already happening, to further to make that work even more impactful. We have every intention to continue to deepen our working relationship with Boulder County Public Health in this space and in the other places that we collaborate with public health. In fact, you'll see the policy team next February at your February meeting as we present the county's 2021 state legislative agenda. So we're just going to continue to deepen that work and make it more impactful, not only for the county and for public health, but statewide. And we appreciate the opportunity to be able to do that. So thank you.
Any other discussion from board members? If not, can somebody make a motion?
This is Morgan. I can move to approve the transition of the, Boulder County's policy team and Office of Sustainability, positions, BCC, sorry, I'm trying to read off of the agenda item here. I move to approve the transition of BCPH positions to Boulder County's policy team and Office of Sustainability, Climate Action and Resilience, also known as OSCAR.
Second.
Okay, we have a motion and a second. Just one other clarifying point, Joe or Bill. So I assume staff are totally on board with this move?
Very much so.
Okay, thank you. We have a motion and a second. All in favor?
Aye.
Aye. Okay, motion carries. Thank you very much, Joe, Mark, Susie, Jeff, and Bill.
Thank you, board.
You.
Okay, item number 4, update on current COVID-19 pandemic. And 3 items under that, or 3 topics under that item. Take it away, Jeff.
Thanks, Greg. We have 3 items. The first is to request to approve Public Health Order 2021-1 renewing a ban on spectators at adult high school, collegiate, and professional sporting events in Boulder County. This is an order that we had in place. The order actually expired on January 4th when the governor moved, as you know, all counties that were in red incidence level to orange on the dial. So our previous order said once we were in orange, this would expire, and it expired on January 4th, 2021 due to that move. We would like to extend this because our incidence level right now is still in red. We anticipate and know that we may have some more cases, as you'll see in the data that I'm presenting, that is associated with New Year's Eve. We won't know that for another few more days, but we want to make sure that we are limiting and doing what we can to reduce spread, and that both school districts we've discussed this with support this and believe it needs to continue. So that is the purpose of this. I want to make sure that Trina has an opportunity here to jump in and add anything relative to the order that she wants to highlight. Trina?
I think you covered almost all of it, Jeff. We have written in the proposed order that it would remain in effect until we are what I would call solidly in level orange metrics. So the way we have it written is that we would keep spectators out of collegiate, high school, professional, and adult sporting events until we have been in the orange level metrics for at least 2 weeks, and we have at least 2 weeks of stable or declining cases within level orange. So you could think of this order as a pre-mitigation effort to make sure that we don't slip back into those level red metrics, which we have right now. Other than that, I think Jeff covered it.
That is all we have, unless you have questions for us.
This is Landry Fagan. I have a question. What relationship does Boulder County have with different sporting organizations in terms of monitoring their behavior in terms of sending kids out of state for tournaments and things like that?
So we work with, and Trina, feel free to jump in here as well. We work closely with both superintendents, but not only just the both superintendents, but also their athletic directors. So as an example, the conversation that we're having right now is around school sports that's coming up as we're moving into this winter and spring semester. And there is guidance that has been published now by, I don't know, I can't remember, never can remember the acronym, but it's CHASA at the state and CDPHE. So we work really closely with both school districts and both of their athletic directors to look at what does this mean, both for in-school kids, wanting to keep kids in school, as well as what this means relative to our own orders that are in place. So we are having those dialogues now. We've been having them for the last about 4 or 5 days. And we'll be publishing some guidance at a statewide level that will go to CDPHE, to all of our school superintendents, as well as to CHASA moving forward. And then obviously when kids travel, they note they have, so if they're traveling from one school to the next because of a sport, they are notifying their athletic director, so the athletic director are aware of when those kids do travel. And obviously, in addition to that, if somebody was identified as positive associated with any kind of travel, that would come in through reporting that we already get through public health. I don't know if that answered your question or not. Let me know if there's other things that are unanswered there.
I guess I just have some concerns having heard about different groups traveling out of state for tournaments. But I just am curious if there's any role for the Board of Health to issue guidance or recommendations specifically as you hear about teams.
So there isn't, I wouldn't at this point recommend that we put a travel restriction in place, but there is conversations right now, like I mentioned with CHASA and CDPHE, about making sure that kids who do travel So let me give you one specific example that we're talking about so you know part of the conversations that are on the table right now. We have right now our mask order requires that anybody that is doing any sports inside wear a mask. And the CHASA's guidance says that masks don't have to be worn for wrestling because of safety concerns. So we've been working through with the districts to think about how might we address that shortfall, but still make sure that kids aren't going to spread it internally within the school. So we've talked about different options, including do we have kids stay remote if they are going to be wrestling, as an example. So those are one of the options that we've talked through, and the same conversations are happening at the Metro Denver level. And I think that'll be included in the recommendations that are intended to come out this evening that go to all the school districts, as well as CDPHE and CHASA. So that's the approach we've been taking versus a travel ban that would be most effective only if it was done across the state. And we have not heard any desire for the state to put in any kind of travel bans at this point.
Okay. That was my question. I have heard about teams traveling out of state, and it just seems irresponsible at the moment. But if there's not a travel ban, then
I think it would be really difficult from a enforcement standpoint to do that. I think our best bet there is education. And I would just like to point out that in level orange, which is the current restrictions we're operating under, indoor organized sports are not allowed unless you are operating as a professional sport like the NCAA or your CHASA. Otherwise, sports is really limited to outdoors with no more than 10 people, organized sports.
So where does youth hockey fall in that
So
rubric?
It's a good question. If they're trying to play as a team, then they can't right now because we're in level orange. They could, in theory, hold strength and conditioning practices in groups of no more than 10 and follow all of the gym guidance. So they have to stay 6 feet apart, they have to wear their masks, etc. But they can't actually play games right now because that would be indoors unless they have an outdoor lake that they play on, in which case they could do it with no more than 10 people.
So I feel like I'm just getting people in trouble, but I need to bring this up. The sports stable, they are having kids participate in a youth hockey tournament in Utah as a team in Salt Lake City this weekend. And I've spoken to people about it. I think it's a very bad idea, but I did want to bring it up as a public health issue because they're sending somewhere around 40 or 50 people, parents and kids, and it just seems extremely irresponsible.
We do have a active enforcement action against the sports stable. I'm not directly involved in it, but I will pass along that information as it's relevant. But right now, the sports stables should not be hosting any indoor organized sport activity. It becomes a little trickier when you're talking about people going to another state.
Right, they're traveling out of state. They're not hosting it at the stable. But yeah, it is. It just seems very irresponsible.
Thanks, Landry. Brooke, I think you had your hand up next.
Yeah, I was just curious if you all have gotten any pushback or if anyone has heard any feedback, negative feedback from this public health order. I haven't personally seen anything, say, in the camera opinions or any place else. So I was just curious if you all have heard anything, any pushback from this.
I'll start, and then there may be others on the phone who could jump in. I know Joe has been supporting the call center and managing it, so he may have some specific feedback relative to this as well. And I know Trina and Kate both are involved in complaints that we receive. When we first passed the order, we did get some feedback from parents who were frustrated that they were not able to see their kids play, and felt like there was ways to space people when we put it in place. At that point, as you probably remember, we were in a point in the state where the majority of all counties, with exception of 3 to 4, were in red incidents, and we had significant spread occurring. So we did hear a bit of feedback from parents not liking or wanting to be able to go and watch their kids play. But again, both where we are right now, as well as where we were then, both districts were strongly supporting the approach that we're taking, because their goal is to try to keep kids in school to the maximum extent possible. Joe, is there anything else you would add to that or Trina?
I don't think there's anything I would add to that. This mainly really affects the University of Colorado. It prevents adults who do want to get together for a soccer game from having other adults congregate around while they're playing, and it prevents spectators at high school sports. Those are really the main effect that it has because of the level orange limitations already. So I think because of that, we haven't heard a lot of feedback on it. I know that CU in particular is very supportive of this, so that is helpful.
Thank you.
Morgan?
Yeah, thanks. I mean, I guess I was just curious, given all the things that changed when the governor changed from level red to level orange for us, how this emerged as the only thing we're really changing. I mean, from what I read, the governor made the universal call, but then allowed local public health departments to actually have stricter rules. Is that right? And so I was just wondering about why this seems to be the only thing that we're addressing in that order. Just looking for your insights on that.
Just to make sure I understand your question, Morgan, when you say this was the only thing we're addressing in that order, you mean from the movement from red to orange?
Yeah, that's right, Jeff. Just that this, I'm just wondering how this emerged as sort of the thing that we're going to do that's going to be stricter for the orange level than it would have been.
Okay.
Out of all the changes that were made.
So we still have our mask order in place that's more restrictive. So we actually haven't lost either of our orders as long as you approve this one moving forward. And when you see the case numbers that I'll refer to tonight, you'll see that we are in a better space than we were a month ago, as an example. So when I go through the case numbers, you'll see some of that. But we still are maintaining the 2 orders that were in place even when we were in red. Again, as long as you approve this order tonight.
Got it. Okay, thank you for clarifying that.
I think if I'm not hearing any other questions, what we need is a motion. I would I don't think we need a motion on anything else. So would need a motion here to move this forward.
Yep. And Kelly, you had your hand up, but you took it down, so I assume you're good.
I'm good. Thanks for asking.
Okay, no problem. Okay, board members, if you want to just follow 4A on the agenda, I need a motion to approve.
This is Landry. I motion to approve Public Health Order 2021-1, renewing a ban on spectators at adult, high school, or collegiate and professional sporting events in Boulder County.
This is Brooke. I second.
Okay, motion and a second. All in favor?
Aye.
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 All right. The next one on our list is an update on COVID-19 vaccine distribution in Boulder County, and Chris is going to take the lead on this one. Chris, the floor is yours.
Thank you. Good evening, everyone. Good evening to the board members. I'm going to walk us through just a quick update on our vaccination administration, which is a great update to share with you all. Additionally, Dr. Bina has joined us and Dear Goodral to answer any questions afterwards after I go through the update. So appreciate that. Let me pull up the update here and we'll walk through that briefly. Okay. Just want to verify where folks are able to see the presentation before I jump into it.
Yep.
Okay, thank you. All right. So just want to give an overall look at where we're at with in the state with vaccination. So about 187,000 Coloradans have been vaccinated with that first dose, and as you see, we're starting to see those numbers grow with the second dose as well. So about 35,000 who have been immunized with 2 doses. One other additional thing I want to point out here is the number of total vaccine providers, which continues to grow, and I think that's crucial to us, to Boulder County, to the state of Colorado. The more providers we bring on to be able to provide and administer vaccine, the better. So good news there. In Boulder County, I wanted to share some of those numbers as well. So we have vaccinated about 10,162 community members, and we are starting to roll into those second doses as well. So about 1,700 community members have received that full course of COVID-19 vaccine. I know this might be a little tough to see on the screen. Just wanted to walk through the statewide phasing plan. Again, just a reminder to community members, to the board. This is the phasing plan the state of Colorado requires Boulder County to follow, and so we're diligently moving through this phasing plan, ensuring community members are vaccinated. We are still focused and still working through both 1A and 1B in that phasing plan. And I would say between really the frontline healthcare workers, some additional members that fall under that 1B, including those healthcare workers, those with less direct contact with patients, first responders, that group as well. We probably have about 5,000 community members left to vaccinate, but we're diligently working through those. You might see also we're concurrently with the hospitals and with other providers starting to vaccinate that age group of community members that are 70 and older. That is a large group of community members, and it's about 30,000 community members that fall in that category. And just want to be clear, then beyond that in the phase 1B, you'll see the dotted line there. There's additional community members that fall below that line. We're going to work through the phasing here, work through those above, those community members that fall above the dotted line in 1A and 1B, and then we'll be moving into those next phases as we move on. I do want to mention one interesting point is in that 70+ group, we have vaccinated about 11% of Boulder County community members that are age 70 and older.
So Chris, can you, sorry to.
Yeah, go ahead.
Can I jump in and just ask you, the 10,000 residents that you said were already vaccinated, how many of those are healthcare workers versus long-term care resident staff? I guess I'm curious, where are we on the long-term care facility staff and resident numbers, percentage-wise? Do you have an estimate of that?
I don't have that number today. I can get that for you. I do know that we have had some great updates that is really moving more quickly. I do think there was some frustration that national pharmacy partnership had not gained momentum like it should have. The CDPHE, the state, has committed to speeding that up, and we've had very positive feedback from the facilities, long-term care facilities in the county that they're starting to get vaccinated. They have, there's a timeline I know out there where all facilities will be scheduled with an appointment to vaccinate residents and staff within the next week, and then they're going to continue to diligently work through that group. So I can get the number. I don't have that broken down yet for you.
Thanks. That would be great just to, if there's an opportunity to follow up with just a rough estimate. Thank you.
Hey, Morgan, this is Indira. It didn't kick off until December 28th, just for reference.
Got it. Okay.
Whereas
So
the hospital started vaccinating, a couple weeks, probably in mid-December.
Okay. Thank you.
This is Landry. I just had a quick question about what the plan is specifically for teachers and if there's any sort of structured plan with the schools, because from a public health standpoint, in the interest of keeping schools open, it seems like teachers should be prioritized also at this point.
Yeah, absolutely. And I thanks, Landry, for that question. And Gary, you can jump in here too. So we have been working with the school districts and they're doing internal planning right now. We're starting to vaccinate even as early this week. There are folks that fall above the 1B. So there are some healthcare workers that work directly with students on site. And we're definitely preparing and getting in place as we move into that larger group to be prepared to vaccinate that group very quickly. And go ahead, Indira, if you have any comments there.
Yeah, Landry, I think there was a lot of confusion about the teachers. So the teachers are actually technically below the dotted line. If you look at the dotted line that Chris has up there, it's really, you should consider that like phase 1C. And so what we are working on, like Chris said, is just supporting the school nursing staff, those that fit into that, category above the dotted line right now. But it's coordinated. Email should go out to those who meet that criteria probably tonight or tomorrow morning. And that they'll start getting vaccinated this week. And that'll be both school districts plus the private schools plus some of the ECE that might meet those criteria as well. But teachers are technically not until below the dotted line. We are working as a metro region to coordinate below the dotted line, because if you look at that list, it's a lot of different types of occupations and a lot of different people. So we need some guidance on how to prioritize.
So I work at Salute, and I've been part of the vaccination program there. We're vaccinating with Moderna. And part of our experience with the elderly, I mean, we're getting people in and prioritizing over 70, but they can't get there quickly. They're debating whether or not to get the vaccine. They keep staff on the phone a lot, like, well, what do you think? That type of stuff. Whereas teachers, and there have been a number of no-shows, so we're usually able to fill the empty slots, since we're doing Moderna and giving it in groups of 10. With other patients who are in the building, or we're calling around. But what I would suggest would be to have lists of teachers, and really when someone no-shows or there's a gap in the schedule and we can't get someone in, most of them would be willing to be there in 5 minutes to get a vaccine, sort of like a will call if there's a cancellation, because it's very challenging to get over 70 to come in instantly in a pinch.
Yeah, and we again appreciate that, and that's a strategy that all our providers we discuss on a regular basis, and they maintain those lists of, in essence, kind of a backup. I think Landry, as you know, it's certainly the number of doses per vial. If you open up a vial or you puncture a vial, then you have to use all those doses very quickly, and you definitely want to make sure you're not wasting any kind of vaccine. So we've worked with all our providers to maintain those lists. We have left them to kind of figure out the guidance there and how they want to approach that, with the overall message certainly not to waste any vaccine. Okay, we'll move on. Yeah.
Just a quick question, perhaps on more specific timing. Do you have an idea when we'll see 1B and then potentially below the dotted line, and 2 based on how 1A is progressing?
Yeah, so again, we are moving in, and 1A and 1B have kind of converged a little bit, so we're really focused on both those, working through those diligently. you know, I've heard estimates thrown out there. I'm a little hesitant sometimes to throw out specific dates, but likely moving across that dotted line is going to be sometime in March, just based on, and I'll go into this in my next slide, really based on vaccine availability and limited, the kind of constrained environment we have right now with limited vaccine. So that's the time frame we're shooting for right now to move below that dotted line is around end of February or March.
Got it. Thank you.
Mm-hmm. And I did want to bring this up for community members, for the board to consider. And I think when we initially brought the vaccine plan to you and started talking about this before we even had any of the vaccines authorized in emergency use authorization, we just want to remind the community that there is going to be, and this is what we're experiencing right now, this projected period of really having limited vaccine. And that's really where we're at right now. So just to remind the community and just to give a sense, so we are seeing about 60,000 doses being allocated to the state of Colorado currently. Those are approximate numbers, but it's approximately 30,000 Pfizer vaccine doses and approximately 30,000 Moderna vaccines on a weekly basis statewide. And currently, as the National Pharmacy Partnership is in full swing and is really moving forward, about 20,000 of those doses are going to the National Pharmacy Partnership for long-term care staff and those residents. So right now it's 40,000 doses available for the entire state, and that's the weekly allocation. So I just want to remind the board, remind the community, it's challenging, and we recognize that we simply don't have enough vaccine. The thing we are proud of is we have 25 enrolled providers in Boulder County. So this includes all the hospitals, CU. We have the Federally Qualified Health Centers, Clinic and Salud. We've forged partnerships with Safeway and King Soopers as pharmacy partners. Boulder County Public Health is doing vaccine clinics. We actually have capacity to distribute and administer more vaccine. We just need more vaccine allocation. So we are keeping an eye on that, and are hopeful that that's going to continue to ramp up as we move forward.
Sorry, this is Brooke. Could I ask a quick question on that?
Absolutely.
So I asked sort of a similar question last time, but for the ramp up, are you basing that on manufacturing ramp up? So assuming that manufacturing will increase and that's what will drive this larger number? Or are there other factors that are going into that?
I think it's a number of things, and Derek can weigh in here as well. So there are additional, it assumes potentially additional vaccines that will be approved under emergency use authorization, including potentially the Johnson & Johnson vaccine, which is easier to handle and which would certainly increase the number of doses to the community. Again, I think the understanding of Operation Warp Speed is there will be additional vaccine in the coming weeks and months of the other vaccines. So, it's still a little bit of an unknown, and it's been challenging, honestly, to plan and scale when you're a little bit unsure of what your vaccine allocation is going to be. So we're in a bit of a tough planning environment. And again, we can only go by what we keep hearing from both the state and on a national level, that the assumption is that we will have access to more and more vaccine.
Thank you.
I think the only thing I would add is that the long-term care partnership is getting a lot of vaccine doses right now, but they hope to be done with that by mid-February. So that's really going to free up about 20,000 doses a week. So that's going to help a lot.
Got it. So also then a reallocation. Okay, thank you.
All great questions. Thank you. just moving on here. So our planning continues and our implementation continues. So we've had some discussion about this. We're ensuring as we're prepared as possible, again, as this vaccine allocation increases. So we are looking at scaling. We are looking at larger scale vaccine clinics or points of dispensing in the county, and the planning group is working on that, so we're ready to go. I mean, if you just take a step back and look at the sheer numbers of community members who need to vaccinate, we're going to have to pick things up. We're going to have to be prepared as a community. So we've talked a little bit about that on a policy level, and we continue to talk about it, honestly, on a regional level and in our community. So our planning team, again, as you recall, is members from both offices of emergency management in the county, Longmont and Boulder Office of Emergency Management, internal public health staff, CU staff are informing that. We're really looking ahead and want to be prepared when we see additional vaccine in the community. We have hired Beth Mendoza. It's really exciting to have her on board. She is amazing, and she's a vaccination cultural broker. So she's going to continue the work that Sheila Davis has been working on. We've already done some community engagement, and we have some survey data. And we want to make sure that we remove barriers, ensure access for all community members. So that continues to frame our planning and discussions, and you'll hear more about that from us in the coming weeks. And again, we are planning for that larger group of community members below the line in 1B. As you see, if you look at some of the categories there, which just full transparency, we still do not have detailed categories from the state, as some of these shifts have happened in the statewide plan, and we continue to push for those. But manufacturing, food and agriculture, public transit, these are big categories, and so we are looking at ways of working to figure out where all these companies are at, maybe document them, start to engage them as well, and really empower them to be prepared to work with us and work with the community to get their staff and community members vaccinated. So that is some of the kind of the concurrent planning and work we're doing currently. I do want to mention also that we are looking to increase our own public health clinic capacity. So we're running a vaccination clinic once a week in Boulder, which we're vaccinating between 450 and 480 community members. We want to scale that, and we're potentially looking at a second day for that clinic. We are running a smaller clinic in Longmont, and that is more of a clinic to gap fill and work with smaller groups that fall in that 1A category and 1B category, potentially looking to scale that as well. So we'll continue, and we did talk about this a little bit. We're also going to continue to monitor those developments in vaccine allocation, and again, that includes additional vaccine candidates should those come on board, or any of the changes we might see with the new administration coming into play, or any policy decisions are made about first or second doses. So we continue to monitor all that, and we'll be prepared should those shifts come, and we should have the capacity to manage those.
Hey, Chris, this is
Yeah.
Morgan. Can I ask another question about sort of from an equity framework and outreach? And I know we had talked at the last meeting about sort of outreach campaigns, particularly aimed at communities of color. I'm curious about, Landry's comment about just knowing Salud's patient mix and what kind of outreach is being done to older Latino adults. I'm curious from Jorge, what you're hearing in your communities about communities of color, particularly the Latinx community and resistance to vaccine, because I wasn't aware historically that we've had real issues in getting Latinx residents to do vaccines in general. So I'm wondering how it's being received by the Latinx population in Boulder County.
This is Landry. I can say on the ground, it's sort of mixed. It depends on how people feel talking to their family. I will say from a clinic standpoint, it's very resource heavy, calling all the lists of patients over 70 and talking them through their concerns, and it puts a lot on our staff, in terms of trying to get people in quickly to schedule appointments. So I'm not sure what's happening in terms of a larger outreach campaign, but certainly our staff is bilingual and we're reaching out one by one, trying to get people on the schedule.
So this is Sheila Davis, and I have been working with the Boulder County Community Task Force and asking members about vaccine hesitancy. And one of the issues that has come up is just lack of access to information in Spanish about the various vaccines as a barrier, and not necessarily being online or internet savvy, and so needing to find this. This information needs to be blanketed everywhere, all media outlets, newspapers, churches, bulletin boards, and that we need to concentrate on that as one strategy to increase the messaging around the vaccines.
I have a comment too, but Bill, it looks like you have your hand up.
Oh, I think that might be me.
Yeah, Brooke, yeah.
Yeah, I had a somewhat similar question, but more general. Have you seen any pushback as you're reaching out to the different groups, including, the groups of healthcare workers? Have you seen any specific sort of pushback or vaccine hesitancy?
So this Indira, a lot of what we've experienced has been, we've had people, ask questions, and, it's a new vaccine. So, it makes sense to ask questions. And we do have people at our registration stations who are able to answer those questions. I have learned about Salud has done a partnership in Aurora with UC Health, where they're going to a church and doing specific outreach to the Latinx community. And so I have asked UC Health and Salud to share their plan, because that may be a replicable model that we can use here in Boulder County. These are all really good considerations too. One of the issues that we're also facing, not just only on language access issues, but those IT issues too. And so we are looking at, is it possible to use existing systems like 211, 311? So we're starting to formulate a lot of plans, but I want to just say that for the BCPH staff, it's been a heavy lift, especially over the holidays. Chris Campbell has been carrying a lot of this. And so we're just in that space, and we're excited for Lizbeth, because Sheila hired Lizbeth, and she's going to be amazing. And we're really excited to have her perspective and to help us formulate future plans that have a strong equity lens to ensure that we are doing all the outreach. And in terms of the information, there is information. CDC has all the information available in all the different languages. That's actually on our website, but it might be we might need to find a different medium in order to get it out. So keep those suggestions coming, because we want to make sure that we use all the good ideas. There's never a bad idea. So thank you.
This is Landry again. Is there any kind of social media campaign or television ads or anything? Because I would agree with the statement that we need to get the information out there, because most of our patients in Spanish, the first time they're really hearing the details about the vaccine from a professional or from a authoritative source of any kind is at the point of care, at getting the vaccine. So we're giving them all the information, and the vaccine safe information, and we're giving it all in Spanish. But many of our elderly patients are not super literate with some of the detailed language in those handouts. So it'd be great if there was a stronger campaign.
I can ask our point of contact. They do have a communication campaign. I'm not sure if Chana's on, but they were supposed to roll it out from the state. But I can ask what's going on with that.
Yeah, just to chime in, there's both a state campaign, but we're also, as we move into our county-wide plan to address COVID, there's a team specifically focused on community engagement and resource coordination that has a heavy focus on the Latinx population, partnering with Guillermo Estrada at Community Services, who has a significant network of cultural brokers in Boulder County that he is in communication with, and we've been working with a communications outfit out of Denver called CREA Results, which has been working with our cultural brokers to train them in not only in basic information about testing and isolation guidance, but also beginning to push out the messaging on vaccinations. And our cultural brokers are stationed, or at times are stationed at testing sites. I would need an update on if that's still happening. And they had been pushing out some of that messaging too.
Hey, this is Boulder. Just want to let you know that we at Amistad we started a couple of weeks ago. It's connected to the family we working with about companies. Sheila shared with me some videos, and I've been researching a lot of other information in Spanish about the vaccine, and we're planning to do some informational sessions with, with some doctors that have agreed to come and present for free in Spanish. I think the crucial thing is here is that the best way to really connect with the Latinx and Latino community is one by one. It's one-to-one. It's in person sometimes. We've been using, a lot of the Zoom platforms. We've been using text. We've been using social media and everything. But still, we're receiving a lot of phone calls lately, pretty much asking similar questions, about when, the timeline or time frame about the vaccine, when they're going to be able to receive it, especially, essential workers, people who actually on the field right now, working in restaurants, working in, cleaning industries, stuff like this. So, this is very helpful to really get it. But if at least for my organization, my team is really working hard to try to reach those families and provide that information. We have a network of around 800 people sign up to a text service that we provide. So if public health or anything that you guys have, that you can send it to me and I can distribute it to them, it's the best way to coordinate. Every person on my team has a network as well in their own communities. We're talking about, Boulder, Lafayette, and Longmont. So I think, the thing is here is really getting the information in Spanish. I see a lot of information in English, and it's really challenging sometimes, and to really get information in Spanish. So the bottom line is that we continue working. If it's any efforts, we, like I offer myself, as an organization to Sheila, that we can definitely coordinate with public health to educate the Latino community and get them ready, especially because it's a mixed feelings about the vaccine anyway. Within my own organization, we have, conversations about that, some people that don't want to get the vaccine, some other people, they eager to get it so they can go back to work directly with the community. But yes, any information will be great. And if it's any coordinated efforts, coming from public health, I'll be more than happy to distribute information.
So Jorge, I'm going to introduce you to Beth Mendoza, who's also a physician. And I know that she is planning, she will be working with Chana and Angela, and they're developing communications plan. So I think that's an important next step.
Excellent, thank you. That'd be great.
Thank you. Okay, it's 6:35. Just want to check in with Chris and see how much more of his presentation he has.
Yeah, I'm just done. I can roll right through it. Greg, thank you. Just about done here. So I do want to remind the community and the board, we would like folks to go and sign up to be notified. This is in both Spanish and English to be notified. So these are for community members. We'll work through that group and be able to notify community members when they can have access to the vaccine. So we just want to remind the board and the community that is a resource available. And I'd just like to end with this same message that certainly, COVID is still with us, and we just ask community, as challenging it is, and such positive news that is coming out with the vaccine rollout and the progress we're making. We still need to stay vigilant and stay strong. So just certainly distance, wash your hands and mask, and continue to do those things we know will help keep the community safe, until we can really get a lot of vaccine out in the community. Thank you very much, everyone.
Thanks, Chris. This is Greg. So one final question from me is, it's good to hear that the infrastructure is there to administer more vaccine when it becomes available. And I know that, one of the ideas for the incoming Biden administration is potentially to release more of that vaccine and then just trust that there's going to be that second dose available when folks need it. Is that within capacity limits? I mean, I guess it would maybe double what was available, right? And so are you confident that can be handled?
I think so, and I'll give a good example. So, Boulder Community Health really wanted to work with this even as early as this week to double their capacity. They've been an incredible partner, and we were really pushing the state to allocate about 5,000 vaccines to them this week. They got allocated 1,000 vaccines. So that's just one example. Other hospitals in the community are not getting very much vaccine this next week. So I feel pretty confident that we could, certainly handle a doubling of vaccine right now. But we're going to we're going to continue to prep for that and be ready to go with other options as well. We continue to bring providers on board. King Soopers pharmacies just came on board, and we'll start vaccinating ideally next week. So we feel pretty confident that we can handle more vaccine in the county and get that administered to community members.
Thanks.
And Greg, just so you know, there are some challenges with releasing all those doses because people really do need their second dose. The first dose is only about 52% effective. It's that second dose that brings you to 95%. So although it's good intent, it could have some potential challenges for us making sure that we get everybody back to get that second dose.
Yeah, that's understood, Indira. And that's what I was wondering too, is are the manufacturers going to be able to pump that out so that people don't, miss their 30-day window?
Yeah, actually the manufacturers are not recommending this approach. Dr. Fauci is not recommending it, but I think that they're just thinking, for some reason at the national level, they think it's just a vaccine shortage, but it's also a real challenge to administer all these vaccines, just given all the challenges logistically.
Good to know. Thank you.
Greg, are we ready to move to the last item under item 4?
Let's do it, Jeff. Thanks, Chris. We'll look forward to future updates.
Thank you.
Thanks, Chris. Thanks for all the work that you and the whole team are doing. It's a immense job with multiple daily challenges that I'm aware of, and I just really appreciate what everybody's been doing. So thank you. All right, so I'm going to share a few slides here. In general, let's see if I've been having a little bit there. Here we go. All right, if somebody can let me know when they see that.
We're good.
Good, thank you. Our data looks actually okay. We do have some increases, and we are watching, as you all know, what's going to happen with New Year's. We still have another 5 days or so before we have a really clear picture of that, maybe 6 to 7 days for a very clear picture. But we do expect a bump, and the mobility data from the state comparative to Thanksgiving was that Christmas and New Year's had more mobility associated with it, but you're going to see that we have seen somewhat of a bump, and we hope it's not a big bump that goes beyond this. We are still at orange level. Our 2-week incidence this morning, it's updated twice a day, so it could have changed this afternoon, was 366.5. Our other two indicators, average positivity rate and stable or declining hospitalizations, are in the yellow levels. So incidence is still the one that is up in the red level. And just a reminder, in order for us to move down a dial level, we have to be in whatever that dial level is for 2 weeks or more. So we're currently in orange. If we don't keep our number below red and in the orange, then the state has told us that even though the state moved us, the state has told us that we would need to be doing a follow-up with them to be talking about mitigation plans. But our numbers are going up and down around this 350. I don't anticipate it's going to be an issue here in the next couple of weeks, but time will tell. This is the metro region, and this is the 7-day moving average case numbers, and you can see the spike that I'm talking about that's here. And again, it looks like Denver has the steepest spike that's happening right now. We hope these are downturns that go down, but I think we'll see a little bit of this up and down movement across here as we go through this next week. This next slide shows our 5-day average. So when I presented last week to during our town hall, our number was around 83 for the 5-day average. So we've definitely gone up. And we hope that this spike is a short spike and not a long spike that brings us back down. And this is our 2-week incidence trend among all age groups. You can see that most age groups are, I would call, stable, slightly increasing, with some ups and downs in our 75 plus here. We have a bit of an up here in this little tail with 23 to 24-year-olds. But for the most part, these numbers are flattened out. Our positivity rate has gone up and down a little bit, but remained below 5% for the most part since about mid-December. And we're hoping that that will continue. Our hospitalizations, this was as of 1/8, was at 42. So a downward declining trend, and we hope that continues as well. Our deaths are also on a downward declining trend. We did have some deaths reported this weekend, and I don't know if those were associated, because there was 14 reported on one day, I believe. I don't know if those were associated with reporting delays or if that might represent another pop up in deaths. But I don't know, Indira, if you have anything you want to add there. That if you know the answer to that, it would be great for the board to hear it.
Yeah, the 14 deaths that we experienced were reporting delays. They happened over the holidays.
Okay, great. Thank you. So anyway, we hope to see this trend decline. Typically, when we see our cases not spiking significantly and stabilizing or declining, we then see a delayed decline in hospitalizations, and then lastly in deaths, and that's obviously what we all want here. I want to talk briefly about school strategies because we had made recommendations to both of our districts. The Colorado Health Institute looked for the Metro Denver Partnership for Health at the latest reviews on the data for kids. The state health department also did the same thing. So in these next couple slides, you're going to see the same conclusion, which is that learning, especially in this younger age group, and schools appear to be minimal in terms of community transmission. So they are not super spreader events that are occurring in schools. Typically, when we see spread happen, it's coming in from outside in the community into the schools. Schools actually provide a safe environment. If you think about it, they require masks. They're a pretty structured day with kids. So it represents a pretty structured day overall for kids in those schools. And even with the University of Colorado, we did not see that we were having large spread within classrooms, the spread was occurring out in the community with parties that were occurring in collegiate housing. Same thing for the Colorado Department of Public Health and Environment. They published this document, which basically is the same findings. They did draw a distinction between the youngest age group and then a slightly higher risk for 6 through 8 and the highest risk in 9 through 12 in terms of being able to spread the disease from kids to adults. Our key messages for schools that we've shared, and this was where our recommendations came from, was that K through 5 should be back in full person based on the research and data. And these recommendations were consistent with the school task force that was in place, as well as with the CDPHE paper that I shared with you, and with the research that CHI looked at for us, and that 6 through 12 should be an in-person hybrid until we're out of the severe risk level. So our school districts followed this. They are starting with this approach at this point, and they're keeping their eye closely on the dial. I think you all know that the University of Colorado, who's going to come present to us in February, has a plan for having kids come back the 3rd week of February. So they're going to talk more about that when they come back. And there's going to be a meeting tomorrow with the university to talk about some of the planning that's going into the spring semester. And this is the last one. Again, some of the same things you heard Chris talk about. It is up to us. Estimated 1 in 105 as of last week, the end of last week, of people who are infectious. That number's getting a little bit better, but that's still a lot of infection in our community. So we can't give up on these prevention strategies that you see here. We have to stay focused on them. And the one thing that we've been sharing with people is to add your phone. So go to addyourphone.com. It is an app that I know you've probably all heard about, and a lot of our staff have done this. We're trying to make sure we're promoting this with our communities when we're doing our town halls. It allows you to be notified if you are in close proximity to someone who is tested positive, and it provides instructions. So it's another prevention strategy that people can take. And that's it. See if there's any questions on that.
This is Morgan. I just want to give a shout out to how amazing our access to testing really has been. It feels like, compared to just my friends and family who are in other parts of the country who have had a really hard time getting tested. And I have used the Stasio testing site myself many times, and the turnaround has gotten faster and faster and faster on getting those results back. So it's just been awesome. I know it's a partnership with the state, and it feels like I have not had to wait in any lines in the last month anyway that I've been going. So it's really incredible.
Thank you, Morgan. And the city of Boulder is a major partner in that site specifically. They actually manage it and run it, which is incredible. So we do have awesome testing in the county. We've been definitely encouraging people, especially around the holidays, to take advantage of it because it's free. You don't have to have symptoms. The state wants people to test. It's in our best interest, especially until we get the vaccines out into the community more. And with this 50% of people that don't know that they have that they're symptomatic or that they don't have the disease, it's really important for people to get tested. So thank you for adding that.
And Jeff, I would just this is Chris Campbell again. I would just reinforce that message that we need to continue to encourage folks, and the board can share this message as well, for us to get tested. We have capacity. We could definitely test even quite a bit more community members. So I would just reiterate and reinforce what Jeff is saying there about getting tested.
Okay, any other questions from the board?
Sorry, this is Morgan. One more question that I don't think was broken out in the data you just shared, Jeff, about just thinking with that equity lens again, our Latinx numbers within the community in terms of cases and hospitalizations.
It has gone down, and I don't know, Sheila, if you have looked at it recent, or Indira or anybody else who's on the phone. I could pull up a slide. Actually, I can pull it up right now for us. If you bear with me for 1 second, I can show you that. But it has decreased in terms of the equity issue. I don't know that we can pinpoint that any one thing that's happened has made a difference there. And I would, maybe while I'm pulling it up, Sheila or Chris or Indira, anybody else on the phone that wants to add to that?
So I have to look at the slides and look at the data.
The pattern that we've been seeing for the last month or month and a half is that the disparity between the cases in the Latinx and non-Latinx communities is decreasing. But recently, the number of cases in both communities is going up. But the disparities are still improving, not quite as much as they were previously.
Jeff, do you have a slide of where it compares, it's disaggregated by rate?
Somewhere in here, yes. Bear with me for a second.
That's the one. That's what I'm looking at. So, I mean, this data, you know, we're beginning to see, you know, a disparate impact in COVID deaths now. And that isn't something that we saw 8 months ago.
That's true.
Okay, good.
So that's what we know.
Thanks for sharing that data. Certainly, you know, want to keep it top of mind and also harkens back to the conversation we had just a short while ago in the meeting about the importance of getting the messaging out to the Latinx community about the vaccine availability and effectiveness.
Absolutely. Maybe, I know it's late, but I would love it if either Lexi or Sheila could talk about the document that we put together that we're going to share with the agency representatives group on Thursday that lays out some of the options for how we might want to move forward in sharing those with our partners.
So just, so I guess we'll discuss this probably at another meeting, right?
Yes.
Okay, great.
But I think you could just share the overall context so that the board knows that, but we can bring it back to another meeting in more detail.
Are you referring to the Latinx brief we developed?
Yes. Yeah.
Okay. Sheila, go ahead, or I can do it either way.
Sure. So we discussed the disparate impact that COVID is having in Latinx communities. And we talk about the factors underlying these disparities. And we also talk about our public health response, which include things like a focus on culturally sensitive planning and policies, improved access to testing, our prioritizing COVID-19 positive Hispanic and Latinx residents, providing culturally relevant communications, coordinating resources, engaging the community, our culturally and linguistically responsive case investigators and contact tracers. So this document outlines what our strategy is. But one thing I'm going to mention tomorrow as well as Thursday is that this is a response to what we're seeing, but it doesn't address the underlying issue of structural racism. And what we need to do, I mean, if we're going to address that, which is the underlying cause, I think that the county has to move in the direction of more shared decision-making between Latinx community and Boulder County government in a different relationship. And that's the deeper work.
Thank you, Sheila.
All right, so let's see. We have got it at 6:55. Tammy, just out of curiosity, it's not before we get to item 7, because we don't have a director's report. So that'll close out item 4 on the COVID pandemic. We
Yeah.
don't have a director's report for the holidays.
No.
We can skip all the new business, and we probably need to take a few minute break before we go into executive session. So that can start a couple minutes late, can it?
Yes.
Okay. I know we have Jana and Wade, or that's going to attend as well. So if the board's okay, we'll skip all the new business this month. Okay, sounds like you're okay with that. So then what we need to do is we need to basically read, if you have the email from Tammy, from, let's see, it was at 11:21 today. Item 3A is, basically we're going to need to announce that executive session, and we need a 2/3. So we have 5 board members. So we'll need 4 members to approve going into executive session. Tammy, should we read 3A or should we, yeah, we should read 3A. So whoever's gonna make that motion, can't me, so can read 3A, and then we can vote on that.
Sure. This is Brooke. I move pursuant to Colorado Revised Statutes 24-6-402-4F to adjourn into executive session for the purpose of discussing the recruitment process for the next Boulder County Public Health Executive Director.
Second?
And
We need a second.
yep, we do.
This is Jorge.
This is Landry, I second.
Okay, thank you. Okay, so all in favor? Aye.
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 I,
Okay, we have 2/3. So we are going to adjourn this meeting. Thank you, everyone, for that great input. And so now, let's see, it's 6:58. So is a 5-minute break good enough for folks?
Sure.
Okay, so just take a quick 5-minute break, and then you have a different Teams meeting. So we need to leave this Teams meeting, and you have another more information in your 7 p.m. Invite as well. Okay.
Thank you.
Thanks, board members. This is where I'll adjourn from you. Appreciate you all, and we'll see you next month.
Okay.
thanks, everyone.
Thanks. Bye.